35, and Andrew, 37, a couple embarking on their journey towards starting a family. Jamila knows she doesn't have the healthiest diet and doesn't do much exercise. Andrew smokes and will enjoy a few too many drinks at the weekend. Setting goals to achieve a healthier lifestyle together. Andrew decides to quit smoking for a healthier future. Jamila and Andrew incorporate regular exercise into their weekly routine. They should be aiming for 150 minutes of moderate intensity exercise per week, such as fast walking, cycling, or dancing. One way to tell you're working at a moderate intensity level is if you can still talk but not sing. Jamila and Andrew learn about a balanced diet, trying to eat more fruit and vegetables and cut down on some less healthy foods, like sugary drinks and highly processed foods. They are following the NHS's Eat Well guide, and Jamila learns that if she gets pregnant, there is no need to eat for two. Jamila starts taking folic acid to ensure a healthy start for their baby. Most people who are trying for a baby are advised to take 400 micrograms of folic acid a day until their 12th week of pregnancy. People with a raised BMI or some health conditions, for example type 1 diabetes, sickle cell anemia and thalassemia, might need to take a higher dose of folic acid, so check with your GP if this applies to you. They decide to avoid alcohol for a safer conception. Drinking alcohol during pregnancy can risk causing harm to the baby. Sometimes this can result in mental and physical problems in the baby, called fetal alcohol spectrum disorder. They know that it is important to take some time each week to prioritise their mental health and well-being to support a healthy pregnancy. If either were struggling with their mental health, there is additional support available via the GP, midwife or health visitor. Jamila checks to make sure she is up to date with all of her vaccinations before trying to get pregnant. She will also be recommended to have flu, COVID, RSV and whooping cough vaccinations in pregnancy, and the baby will need some after birth. These vaccinations are to protect Jamila and her unborn baby from serious illness and disease. Jamila learns that it can take women longer to get pregnant as they get older, particularly after the age of 35. While most older women still have a healthy pregnancy, there is a higher chance of some problems during pregnancy and childbirth. She seeks healthcare advice for a personalised approach on how to manage health conditions when trying to get pregnant. Jamila and Andrew turn to their support system for encouragement as they work toward their goals. They think about making space for the baby at home and how much money they might be able to save. They are preparing for parental leave and maternity pay, as well as other benefits they might be able to get, such as universal credit and child benefit. They also learn about what might happen when they get pregnant. This includes booking their first appointment with a midwife before Jamila is 10 weeks pregnant. This is to make sure that Jamila's needs are identified early and to do some tests that ideally should be done before 10 weeks of pregnancy. They make sure to celebrate victories, big and small, on their path to parenthood. Jamila and Andrew are ready for a healthy future. Their journey to starting a family begins with their commitment to physical and emotional well-being. To find out more about preparing for a healthy pregnancy, please follow the link on screen or speak to your GP.